The CDC is extending the federal transportation mask mandate through May 3rd. It was originally set to expire next week.
And this comes as coronavirus cases rise across the United States thanks to the highly contagious Omicron subvariant called BA2. The CDC says it is the dominant strain in the U.S., estimating it caused 86% of new COVID cases nationwide last week. While cases are rising, experts say hospitalizations do remain at record low levels, and deaths from this disease also continue to fall.
For more, I'd like to bring in U.S. Surgeon General Vivek Murthy. Dr. Murthy, welcome. It's great to have you with us. So now that the BA2 subvariant is the dominant strain of COVID in the U.S., how does it compare to some of the other variants we've seen so far, like Delta, when it comes to hospitalizations and deaths?
Well, this is a great question. And I want to make sure people know we are going to hear news over the coming weeks and months about new variants, subvariants that crop up. And what I want us to understand, though, is that we have a bigger toolkit for dealing with these variants than we've ever had before. These are our vaccines, a greater array of treatments than we've had before, and of course, freely available tests and masks. But when it comes to BA2, here's what people need to know. This is a variant that seems to be somewhat more transmissible than the version of Omicron we were dealing with in December and January, about 30% more transmissible, but it does not seem to cause more severe disease. And very importantly, it still seems to be responsive to the protection we have from vaccines and to our oral medication. So this is all good news. What it means is that you have to make sure you get that vaccine, get boosted if you haven't already. Make sure you know that Paxlovid and other oral medicines are available. And because of the test and treat initiative that President Biden announced a month ago, we now have the ability for people to go in and get those treatments at pharmacies around the country. So this is all good news, but we have to remain vigilant because the pandemic is not over and we've got to be ready for whatever may come.
And on that note, Doctor, just today, the CDC extended its mask requirements on planes and public transportation by 2 weeks. Of course, it was set to expire this coming Monday. So what do you expect to see during that time period that is behind this decision? And if it is lifted in May, could it be reimposed?
So the CDC's decision is based in part on the fact that, look, we have cases going up right now. And what the CDC wants to be able to understand is the trajectory of those cases. Are they going to continue to go up? And if so, how high? Right now, we thankfully are seeing cases still remain at historically low levels compared to where they have been over the last many months. But that rise is something the CDC wants to monitor. We are also seeing hospitalizations relatively flat, which is good. We hope that they don't surge, and certainly nothing like we saw in January. But the CDC wants to be mindful of this and wants to keep an eye on it before it pulls back those types of federal mask requirements on planes. Let me lastly say this, because sometimes people are wondering, well, why do we have them in planes and trains and buses, but not in certain other indoor settings? There's something that's unique about travel, which is that, number one, you bring a lot of people together in a closed environment for a prolonged period of time, which inherently could be higher risk. But many people don't have the option not to travel. Imagine your mother is ill and you need to fly across the country to see her, or you have to travel for your job, and not traveling might mean that you would lose your job. So because it's not an option for people, it bears being cautious in those environments, make sure people have the protection they need, especially as cases are going up.
Dr. Murthy, we are also seeing some cities like Philadelphia, for instance, reimpose indoor mask mandates in response to this recent BA2 surge. What is driving this? Is it the unvaccinated population? Is it vaccine protection that's starting to waver? Or is this a larger infrastructure problem with buildings and places where crowds gather, like buses and trains, which you just mentioned, not being properly ventilated?
Well, these are a number of factors you mentioned, all of which can contribute over time. We know we still have tens of millions of people in our country who are not vaccinated. I worry about them because that means that they're at greater risk, not just of being infected, but also of ending up in the hospital or losing their life. And that's happened to nearly 1 million people in America, which is tragic. We also know, though, that over time, the vaccines, even though they're highly effective at keeping you out of the hospital and saving your life, that they do require boosters. And this is not unusual. Lots of vaccines require boosters. So if you are, for example, more than 5 months out from getting your Pfizer or Moderna vaccine, you do, in fact, require a booster. If you're more than 2 months out from getting your initial J&J shot, then you do require a booster as well. And if you're 50 years old and up, you are actually eligible now for a second booster shot. if you're 4 months out from your first booster. So the bottom line is we need the ongoing protection of the vaccines, which is why getting those boosters is important. I'm worried, though, because only about 100 million people in the country have gotten boosted. That means there are many more people out there who need to get the protection of the vaccines. And the more who do so, I think the fewer cases we'll see, and certainly the fewer hospitalizations and deaths.
And Dr. Murthy, of course, you are the top doctor in the nation. You've talked publicly about having COVID yourself a few weeks ago. So that being said, a lot of people are wondering, are we all destined to get it? And is that part of the path that gets us to an endemic stage?
Well, certainly, I think what will help us in the long term is to make sure that everybody in our country has some degree of protection from the virus. Now, we've been advocating for people to get vaccinated because that is the best studied pathway to protection. We also know that people get some protection from prior infection, although we'd rather them get vaccinated than subject themselves to the risk of getting infected, because we know that the COVID doesn't just affect your lungs, it also affects your heart, your kidneys, your nervous system, your brain, and many other parts of our body. But right now, we have a very large portion of the population who's been either vaccinated, infected, or both. But again, knowing that protection wanes over time, we've got to make sure that people get boosted regularly. And if people do, then I do believe that we can reach a state in the near term where we can learn to live with this virus, still see our family, still go to work, have our kids in school without having to worry so much about the untoward effects if they fall ill.
Dr. Murthy, you talk about regular. How regular is regular?
That is a good question, and we don't fully know the answer to that yet because we are still learning about how our bodies respond to the COVID-19 vaccines over time. We do know at this point that getting 2 shots of your Moderna or Pfizer vaccine will protect you for a good solid 5 months, but that you need a booster after that. Whether we're going to need an annual booster or whether we'll be able to space them out more and do it every few years, that remains to be seen. But the bottom line is we want to be prepared for whatever this scenario is. It's one of the reasons we've actually been asking Congress for more funding for the COVID effort, because we want to make sure that vaccines are there for people when they need it, that we're continuing to develop and improve upon the vaccines we have so that they can be even better and last for even longer.
All right, Dr. Vivek Murthy, thank you so much for joining us. We appreciate your time and your insight.
Of course. Good to be with you both. Thank you, Tanya and Nancy.